CMHA PEI Division was first established in 1959 and serves thousands of islanders across the province each year. We have over 80 employees and over 150 volunteers. We strive to be a key partner in strengthening and enhancing people's abilities to achieve and maintain positive mental health. CMHA PEI serves anyone and everyone living in PEI. Different programs and supports focus on different needs and in building different capacities. One of our largest programs at Canadian Mental Health Association is our Clubhouse program, and we have 3 locations across PEI. We have Hope Centre Clubhouse in Alberton, Notre Dame Place in Summerside, and Fitzroy Centre in Charlottetown. Clubhouses provide psychosocial rehabilitation to individuals that have experienced mental illness, provides members with the opportunity to set personal goals, access supports, and become members of a supportive and restorative community. Clubhouses accept referrals from anyone, although a primary diagnosis of a mental illness is confirmed through healthcare providers. CMHA provides a range of housing supports for individuals across PEI, including rent subsidies, supported housing, housing first, housing outreach, and transitional housing. Currently, we have 181 units that we oversee across PEI, with another 28 scheduled for completion by July of 2022. CMHA's Housing First program is funded by Service Canada through the Homelessness Partnering Strategy and is based on the highly successful evidence-based model which was researched by the Mental Health Commission of Canada. It is premised on the idea that major barriers to well-being are very difficult to address while homeless. With this program, housing is arranged immediately and then intensive supports are provided to address these major barriers. CMHA's Transitional Housing Program offers an intermediate step between hospital or institutions and permanent housing. It assists individuals with mental illness move toward greater autonomy and self-sufficiency. We have 10 beds with 24-hour supports, including 4 single rooms, 4 training apartments, and 2 time-limited respite beds. CMHA's Housing Outreach Program provides supports to identified individuals with mental illness to help them obtain and maintain their housing in the community. The Housing Outreach team works closely with participants to secure housing and to develop key living skills with the goal of transitioning to independent living. CMHA's Suicide Prevention and Life Promotion Program coordinates a variety of suicide prevention, intervention, and postvention strategies in an effort to reduce the rate of suicide and to lessen the impacts of suicide and suicidal behaviors in PEI. There are strategies to promote life and living by strengthening community supports and enhancing resiliency, all of which contribute to building suicide-safer communities throughout PEI. CMHA's Learning, Training, and Support Hub is a unique mental health and wellness learning space. We offer in-person and online training across PEI using adult education strategies and health promotion approaches to increase awareness, improve well-being, foster positive mental health, and develop skills for resiliency. CMHA's Peer Support Program currently employs 8 peer support workers across Prince Edward Island who work one-on-one with clients, host peer support groups, participate in educational opportunities, and supports the CMHA Learning, Training, and Support Hub. Referrals to the program are accepted from service providers and self-referrals as well. CMHA's Family Program is an 8-week course for individuals supporting a loved one with a mental illness. The program was designed by peers to educate, support, and equip individuals for the journey ahead. It is offered at various locations at various times of the year across PEI. Registration is required, but the program is free. Life After Suicide Loss is a 9-week suicide bereavement group facilitated by community mental health clinicians and supported by CMHA staff. This is typically followed by a monthly support group, and although registration through community mental health is required, the program is free of charge. CMHA offers 2 school-based programs on PEI. Somebody, which is intended for grade 3, that helps young people understand and learn about mental health and increase skills that promote personal development and successful relationships, and Signals of Suicide, that explores the topic of suicide with youth and teaches them ways to seek help for themselves and their peers when they are in distress. This program is delivered to every grade 9 student across the province. The White Cross program is CMHA's longest running program, beginning in the 1950s, and offers social and recreational activities in Queens County for people who are over the age of 18 and have experienced mental or emotional health problems. Monthly events are held, such as dances, bingo, and beach days. And at Christmas time, a gift campaign across PEI collects and distributes gifts to individuals who may be vulnerable during the holiday season. And this program is certainly built through strong community partnerships. CMHA provides many training opportunities across PEI, including Changing Minds, a 2-day mental health awareness training for staff who interact with people with mental illness, with a focus on different illnesses, interactions, and reducing stigma. Mental Health First Aid, a 2-day workshop that builds awareness of mental health, signs and symptoms of mental illness, and providing crisis intervention skills. Mental Health Works, workshops of varying lengths that provides training and strategies to help workplaces in supporting their employees' mental health, and various programs offered through Living Works, specifically START, an online awareness program, Safe Talk, a half-day workshop which promotes suicide alertness and helps to develop skills to recognize thoughts of suicide and how to connect the individual to appropriate resources. Assist, a 2-day workshop which provides caregivers with the practical skills needed to respond to a person with thoughts of suicide. And Suicide to Hope, a 1-day workshop designed for clinicians and professional helpers who work to aid in the longer-term recovery and growth of persons with previous experience with suicide. CMHA currently assists over 35 self-help groups across PEI, assisting with space, support, and training. No registration, referral, or payment is required, and we have those groups listed in a weekly Guardian column on Wednesdays, posted to our website, and shared with 211 as well. CMHA offers many resources across PEI, including the PEI Helping Tree, resource libraries in various offices, including books and brochures, illness-specific kits that are distributed through inpatient units, survivor of suicide loss information kits, child grief kits. We do promotion for the Island Helpline, and we also distribute doctor information kits as well. CMHA does many public presentations throughout the year across PEI that promote mental health and reduce stigma associated with mental illness. Topics vary from strategies for good mental health to awareness of specific mental illnesses, and are delivered to diverse community groups, businesses, and workplaces, and are designed to build community networks by providing relevant information on local supports and services. CMHA has a multitude of partners, including other organizations, businesses, and all levels of government that assist us in delivering programs, supports, services, and resources. Please check out our website to find out more about specific partners and supporters. For more information, visit Canadian Mental Health Association online at www.pei.cmha.ca or call one of our numbers at our offices in Alberton, Summerside, Charlottetown, or Montague. We are also active on Facebook, Twitter, and Instagram.